Welcome to Stimulate Conversations, a sexual wellness business discussions podcast that supports the vast range of professionals supporting consumers from a business perspective within the sexual wellness space. My name is Nicole Lameck, your host, and the founder of Stimulate, a B2B sexual wellness trade show held annually in Nashville, as well as many other Stimulate experiences throughout the year. I'm also author of the book Retail 101 from McGraw-Hill and professor of retail marketing at Columbia, Chicago. From head to toe, young to mature, purpose to pleasure, Stimulate Conversations is committed to supporting sexual wellness professionals. Together with industry leaders as our guests, we look forward to delivering trusted and important conversations to help support retail, wholesale, spa, salon, and medical professionals who collectively want to help elevate and support their consumers within the sexual wellness community from an educated and professional perspective. Listeners of Stimulate Conversations can look forward to gaining expert-led insight from industry leaders, ranging from doctors to retail operational experts to industry visionaries and more. Without further ado, let's dive into Stimulate Conversations. Welcome to another edition of Stimulate, where I am so excited to introduce you to our guest today, who is Miami-based urologist, Dr. Amy Pearlman. Dr. Pearlman and I had the pleasure of speaking quite a few times in recent weeks, and I'm so thrilled to share the conversation that I'll have today with her, with each of you listening. And she is going to be discussing men's sexual health and how sex toys and tools can benefit men's sexual health. And I can't wait to dive into this conversation. And without further ado, introducing Dr. Amy Pearlman. Welcome.
Hey, folks. It is so good to be here. I cannot wait for this conversation.
Me too. So I would love for you to first start by giving our listeners an introduction of who you are, how you got to where you are today. Give us the depths and the deep history of Dr. Amy Pearlman.
So I grew up in the big state of Maryland, and then I wanted to go to a completely new place. So I went to the University of Miami for undergrad, and then I went to Baylor College of Medicine for medical school, University of Pennsylvania for my urology residency, and then I did an additional year of specialty training, specifically in men's health at Wake Forest in North Carolina. I had the opportunity to start my career and really build that foundation at the University of Iowa, where I directed the men's health program for 4.5 years. And then I made the riskiest decision I've ever made in my life. And I left my wonderful, very stable academic job, and I started my own practice called Prime Institute in the Miami area with my twin sister.
Which I love. I recently found out that you were a twin, and I'm also a twin. We're both identical twins, which I just think is a fun little fact. But I want to go backwards and talk to you about how and why you became interested in men's sexual health and men's health specifically.
I think that looking back now, it all makes sense. Like, it was always in my story. I just didn't realize it at the time. As a kid, and I know this is kind of weird to say, but I love talking about sexual health, like as a teenager. And then, during undergrad, just study the regular biology, like important, but like not super interesting. And then I decided on urology. Now, a little sort of back history here. When we're in medical school, we do a lot of different rotations. I think at the end of the day, I would have enjoyed doing a lot of different things in medicine, okay? And sometimes it's one big experience that encourages a big career decision. And sometimes it's a compilation of little different decisions, people we meet along the way. And that's really what encouraged me to go into urology to begin with. But most of urology is not actually quality of life concerns for men. Most of urology, although we do see a lot of men, deals with prostate, whether it's for non-cancerous reasons or cancerous reasons, urinary tract infections, kidney stones, kidney cancer, stuff like that. But a big part of men's health is erectile dysfunction. But it wasn't until my last year of training, to be honest with you, when I worked really one-on-one with a gentleman at Wake Forest, and I saw someone sit down with grown men and really educate them about their bodies. And so often it was like a light bulb went off in that room or turned on, where guys were actually understanding the, normal structure and function. And so it wasn't until my last year of training, actually, that I decided that I wanted to do men's health. And then it wasn't until I was directing the men's health program at the University of Iowa where I truly appreciated the importance of sitting down with someone and simply talking to them. And perhaps, Nicole, that is my biggest therapeutic benefit, is my ability to listen and talk with people.
Well, I mean, that's easy to gain just from listening and speaking with you and allowing me to pick your brain like I have in past discussions. And I'm so grateful for that because I know there's so much misunderstood about men's sexual health. And you take it a step further, and maybe that's the wrong way to look at it, but you've taken it to a place of like, let's look at how sex toys and tools, as you call them, can aid in men's sexual health. So kind of paint that picture for us. What does that look like? How did you come to that place of being like, let's do this, let's talk about it, let's listen?
My interest in understanding the utility of sex toys and tools when it comes to the medical field started about 2 to 3 years ago. And I saw a woman, Rainey Horowitz, and she has an incredible Instagram page called Sexplained. And she discussed sexual function and sex toys in a medical way, which is what I was used to. And I absolutely loved her content. So I reached out to Rainey and asked if we could co-educate. And so we created some things together. And she was a medical student at the time. So I'm like, 10 years her senior. And there was so much that I was learning from her because she had so much knowledge in that space. So that was really the initial impetus. And then I went to one of our big sexual medicine meetings, and it was in Arizona at the time. And I connected with a gentleman who owns an online company. The spray that he has, the product is Permescent, a delay spray, but he also sells a lot of sex toys and tools on his website. And so I asked him to send me a bunch of different products so I could check them out. And it wasn't until I really saw them in person and started discussing them with my patients where I really understood the benefit. But it was really, speaking with two people that were kind of like within healthcare, but not involved in my day to day. And I'm learning from them. In fact, much of the time when I change my practice, it's not actually learning from other urologists, although I do learn a lot from my colleagues. It's learning from people in other industries of healthcare and sexual medicine.
Well, I love that you've continued your education, so to speak, throughout your professional career and that you are willing to learn and listen. And I think that's really, no matter who's listening to us today, for example, I think that's the key, and always be willing to listen, learn, expand what you already know to what you can know more of, right? And so with that, I have to imagine some of your patients aren't necessarily familiar with sex toys or tools, right? And maybe they're not comfortable even for many of them, but yet some might be. So how does that conversation look like when you're talking to your patients?
Yeah. So whenever a lot of people ask me, like, do men even want to see you? You're a woman. And I think in the back of their minds, they're sometimes asking, well, what does a woman know about men's health anyway? And the reality is, I know quite a bit because I've studied the male anatomy and structure and function. And I would even venture to say that I know more about men's health than I do about my own as a woman. And I've been living in my body for 37 years. So, whenever I start off a conversation with any gentleman who shows up in my office, before we get into the reason for their visit, I say, before we get into the reason that you called in and showed up today, let's just talk about your overall health. Do you have any chronic conditions? Have you had any surgeries? Do you have any allergies to medications? So we start with questions that people are used to answering within the healthcare setting. And then after, let's say, 10 minutes or so, where I've had the opportunity to build rapport with that new person, then we get into the sexual health topic. And, we learn in medicine to start off with open-ended questions. Things like, how can I help you today? But Nicole, what I found in the sexual medicine space is that sometimes open-ended questions are good, and sometimes we have to give people or offer them terminology and the language. So I might say, my understanding that you're here to see me today is to talk about sexual health. So let's talk about your erections to start. Do you have any issues getting or maintaining erections? Because if I were to start off that conversation with a very open-ended conversation, it can be difficult for guys to enter into that conversation. Now, when it comes to sex toys and tools, do I have that discussion with every single guy who walks in my office? And the answer is no. The answer is no, because I have to get the vibe. And too often, I think in medicine, we're so used to checking the boxes, right? We have to ask these 10 questions or these 30 questions with every single person that walks in the room. And that's not really the case. And that's not how we practice personalized medicine. So, Nicole, I get the vibe of the person sitting in front of me. But the other thing I've recently done is I've updated my educational material. So I send everyone out, either I send it electronically or I give them a printed packet. And it talks about all the ways we can improve sexual function or erectile health. And I've recently added information on sex toys and tools. So even if we don't have the discussion in person during that visit, I'm still giving them information that they can read at home.
That's so awesome because you've given them a variety of ways to connect at their comfort, which is amazing. And I think that's key right there is making sure, you're meeting them where they're comfortable, either having that conversation or reviewing it in private, maybe speaking to you later. And now I want to actually talk about what sex toys and what sex tools you're suggesting or just giving insight on, because, certainly we have, our listeners come from a variety of places. They are working in retail environments. Sometimes, a patient of yours, let's just say, could go to a retail store later looking for some sort of aid in their erectional health or something else. Other times, potentially they're buying it within your own environment. I think that's the beauty of consumer business. It can go anywhere. So for our listeners who are trying to wonder, what would I do if someone said, hey, I need better support in holding an erection? Is there that you could suggest to them from a tool or a toy?
Yeah, absolutely. And I think this conversation is, so often when it comes to men's health, we're so used to pathologizing it or medicalizing it or saying, what's your problem? What's your chief complaint? In fact, in the healthcare system, when someone comes in, like the first question or the first point on our office visit note is chief complaint. I think that's a problem. Why does someone have to have a complaint or a problem to warrant sitting in front of us in the healthcare setting? So a lot of my discussions around sex toys and tools is actually not about a dysfunction. It's about this idea of, do you want to have better sex? Do you want to experience improved pleasure? And you don't have to have bad sex, or you don't have to have a problem with erectile function or, a problem with reaching orgasm to benefit from these products. So I like to term it in terms of better rather than a dysfunction. So let's talk about some of these tools.
Okay.
Now, when it comes to genital health, this is important in people with any body part, with people of all genders across the gender spectrum. Blood flow is good for the tissue and it's good for the health of the penis. So even if we take sex out of it, we need to have the penis stretch and be exercised on a regular basis to maintain its length and girth. So Nicole, while a lot of men come in to see me because they have a drop in sexual function or erectile dysfunction, when guys are no longer exercising their penile tissue for a period of time, the tissue actually changes. It's the same thing with a bicep muscle, right? If we were to work out at the gym for 6 months and then stop working out, we wouldn't be surprised when our bicep muscle got smaller. And it's the same thing for the penis. So we want to maintain length and girth. So one device is, and I would consider this like a sex tool, like a rehabilitation tool, is for guys who, let's say, have lost penile length or have curvature of their penis. The Restorex device is a really good device. Now, I know it looks like a medieval torture device, so let's just call out the elephant in the room here, okay?
Yes.
But the gentleman in the flaccid, so the non-erect state, would put his penis through here, okay? And then he would protect the tip of the penis. He would clamp down and it's spring loaded. So then he can hold it out like this, okay? And if that gentleman has curvature of the penis, then in the non-erect state, he can configure it so he can bend the penis in the opposite direction. So there are a variety of devices out there. I like this device in particular because the company has done a lot of research to support its use, not only in men who have penile curvature, but also after prostate cancer surgery. So a lot of guys want to have a bigger penis, okay? A lot of guys have lost length and girth, and we have to normalize the conversation about safe and effective tools that guys can use on a daily basis to improve their genital health. So another device that I want to talk about, especially in the rehabilitation space, is a vacuum erection device. We also call it a VED. So it's a device that looks like this. This one is battery powered, but they're also like this one in particular has one where you can just attach a manual component right here. So the gentleman, either in the flaccid state, partially erect, or fully erect state, would put his penis in the canister right here. He would put lubrication around here as well as on the penis to get a good seal. And then, and you can't really see, but like, I don't know if you could hear that, but it creates.
I can imagine there's a lot of suction and strength within that going on. Yes. Yeah.
Yeah. And then if I were to put this one on here, okay, so this one's manual. And then I would just go like this and it creates a suction and it literally pulls blood into the penis. So guys can use this. Let's say if they have a 75% erection and they want to top off the erection, this can help pull additional blood in to get a full erection. Or those guys, going back to the guys who, let's say, aren't getting daily erections or exercising their penile tissue on a daily basis, this can help stretch out the tissue on a daily basis as an exercise program. So in general, we recommend 10 minutes a day with a device like this. Now, if that guy is already getting good daily erections, then a device like this is less important. But Nicole, if someone were to say, hey, I want a 6-pack or I want to, change my body and get in really good shape, do I need to move my body on a daily basis? Any personal trainer would say yes.
Yeah.
And that's the same thing when it comes to optimizing genital and penile health.
Yeah.
So
that like it's a muscle, of course. Well, no, it's not. Is it a muscle?
So there is muscular tissue in the penis. And we call it, we say like a boner. So some people think that there's like a bone in the penis. There is no bone in the penis, but there is muscular tissue. And so it really is just another part of the body that needs good blood flow. And really the penis is a barometer of overall health. So when we think about our internal organs, we don't really know what's going on inside of our body. We don't know if we have kidney disease or liver disease, unless it's really bad. But the penis, we look at that as like a door that just opened. So if the penis is working or not working, it gives us a really good sense of the overall cardiovascular health of that person. Okay.
That is something I've recently learned. And I have to tell you, it was like eye-opening to me. I'm like, wow, I never looked at it from that perspective. And it's like one of my favorite conversations now to have with like friends and family. And they're like, Nicole, why are you so interested in erections and cardiovascular health? I'm like, because I never knew it was related, but something I've learned. And I truly find that so fascinating.
Yeah. And it's really an opportunity for men and healthcare providers to help that person sooner rather than later, rather than waiting, 10, 15 years before that person, let's say, has serious heart issues. I look at it as an opportunity. What can we do today to improve your overall health and your genital health? And when we talk about genital health and exercise, it takes some of that stigma out of it. So if I have a gentleman in the room, whether his partner's in the room, a child, an uncle, an aunt, a brother, a cousin, a friend, when we talk about exercise and rehabilitation, it's really difficult to offend anyone when we take some of that more stigmatized sexual conversation out of it.
Yeah, that makes sense. And it's so important. And there should be no stigma. But as we know, there is stigma surrounding sex and sexual well-being and the health of sex and the nature of where we are in our personal journey of sex, unfortunately, in society. So it's so great that you're sharing this insight. I'm also curious about the toys. So you shared some tools. Let's talk about toys. And if you have any examples, we'd love to see them.
Yes, I would be delighted. So I recently wrote a chapter on looking at all the research that's currently in the literature when it comes to sex toys in men. And it was an easy and a difficult chapter to write. It was easy because there's not much out there,
right?
And difficult because it's like, well, how are we going to fill the pages with good content when there really aren't that many studies? And the studies that are out there on the use of sex toys in men, they don't have many patients. So a lot of my recommendations when it comes to sex toys is what does the existing literature show, but also what do guys tell me they like? And while research can be really helpful to inform our decisions, simply asking a patient, hey, I know you tried this product. What did you think? That can also be really helpful in terms of guiding my patients in the office. So let's talk about vibrational therapy, because we know that different vibrational products are really helpful in vulva owners. And I use that term again, vibrational therapy or vibrational products, because if I were to use the term a vibrator every time that I was talking with a gentleman, they oftentimes think that's only for women, but vibrational therapy is for people with any body part. So one device in particular is by a company called Mystery Vibe. And this part right here acts as a constriction band. So the gentleman would put his penis through this. So it helps keep blood in the penis. And there's a vibrational component that then goes to the perineum. So that's that area between the back part of the scrotum and the rectum. Now, there are other tools, and I don't have an example to show today, but prostate massagers. So there are a lot of nerves that surround the anal area that go into the anal canal where you can stimulate the prostate. So many nerves in that area. And what's really important that we emphasize to people is that where one experiences pleasure has nothing to do with their sexual orientation, okay? It just has to do with what feels good at that given time. And even things like nipple stimulation, we think of that for women, but I have a lot of male patients who really enjoy nipple stimulation. So a lot of the tools or toys that we would use for female body, folks can also be used in men. And vibrational tools are one of those. Now, other products, this is called the Hot Octopus. I know it's a very interesting name, but it's a sleeve or a stroker that goes around the penis and vibrates. Yeah. Now, are these products good for everyone? No. Just like with women, there are certain products and they're all so different. They all have very different vibrational settings. And sometimes it's like sometimes a person might like a product a year ago and a year later, they no longer like it. So I encourage the same thing in men. Is you got to try a few different things to see what works at that given time. But the Hot Octopus is another product for penis owners.
Yeah, I love that. I look at it as taste buds, by the way, because our flavors change over time. Our taste buds change over time. So like vibrational therapy might be something someone enjoys for a couple of years. And then all of a sudden they're like, you know what? I prefer this sensation now. Or it better, I should say, right? So yeah. I love that you've approached it that way. And it really is interesting to see all the different ones. So show us more.
Well, I'm gonna start using that term taste buds when it comes to this, because it is so true. And also it could be, what do we prefer when we're by ourselves and with a partner and with this partner or that partner? So it changes all in a given day. So other products that we can use. So this is the FirmTech device. It's like an Oura ring for the penis. So it's really cool because when we think about all the wearable devices out there, we can track our heart rate variability, our stress, our sleep. We can track so many things, but there was a gap in the market and we couldn't understand erectile function. So when I would see gentlemen in the office and I would ask them, are you getting nighttime erections? Are you waking up with a morning wood? A lot of guys really don't know what's going on with their erections overnight unless the erections are waking them up or they wake up to urinate, right? So this device actually gives us real-time information on what's going on with erectile fitness. And again, you don't have to have, with any of these tools that we've discussed today, you don't have to have a problem or a pathology to benefit from using them. Someone could be getting great erections and still benefit from using a vacuum pump. And it's the same thing with a constriction band. So this device here, one ring goes around the base of the scrotum and the other goes around the base of the penis. And the nice thing about this band here is it's tight enough to keep blood in, but not too tight that it prevents blood from coming in. So a guy could wear this even when he's, let's say, watching a movie or engaging in foreplay. It will still allow blood flow in and help keep it in. A lot of guys, when they see me, there's so much performance involved in like having sex that they can't get out of their heads because they're just wondering, am I going to be able to maintain? Can I reach climax? Can my partner reach climax? What if I orgasm too soon? And devices like this help take that out of it, where they know they're going to be able to maintain that erection for a longer period of time.
Yeah, I'm familiar with that device. In fact, we have its founder, Dr. Elliot Justin, I believe his last name, Justin. Mm-hmm. So Dr. Elliot Justin is actually joining us for a future episode. So we're super excited because, to your point, what you just said as well, like, the cardiovascular health can help be understood too by using something like that. So if you recognize by using that you're not have as many, let's say, erections, right? There's an indication something else could be going on. That's my understanding, at least.
Absolutely. So devices like the FirmTech Tech Ring, they help both with diagnosis
Mhm.
of whether or not there's an issue, but they're also therapeutic in that they can help maintain an erection for a longer period of time. So they kind of serve two purposes there. But just like with any of the wearable devices, like you don't have to have a sleep problem to benefit from wearing, a wearable device that gives you insight about your sleep. And it's really the same thing when it comes to erectile fitness.
I love that. So if there was someone listening, whether it is again a store operator or a medical professional or simply a consumer interested, where do you typically suggest to your patients to discover these tools or toys? Where are you suggesting for them to make those purchases?
So that's one of the challenges, right? Because there are a lot of different devices out there, and you really do want to find a good product.
Right.
So, like on my website under resources, so my website is primeinstitute.us, I have a curated product recommendation page. And oftentimes in medicine, we're not taught how to recommend products. It's kind of seen also as a stigmatized topic or a taboo topic because we should allow our patients to choose. And if there's any financial gain, then that's like a very sort of like taboo thing to discuss. But I've realized that one of my most important roles as a healthcare provider is to recommend good products. If I just tell them to go to an adult store and to decide for themselves, it's too overwhelming. You go to like a Walmart and you try to buy like a coffee maker, there are 30 options and you walk out empty-handed because you don't even know where to begin. So I have to give my patients and clients a place to begin. So on my curated product recommendation page, I have some good products and I'm always looking for more.
Well,
Okay.
I have a feeling
Always looking for more.
we have a lot of great brands and a lot of brands, of course, that sell various men's toys and tools within that we represent at Stimulate, which is our annual show in Nashville. So we are very connected, I should say. I hope that they reach out to you. And in fact, on that note, you've mentioned your website, but how else can people stay in touch with you?
So I have on my Instagram, Amy Pearlman MD, and then we also have an educational website, Pearlman MDs. So those are the main ways there. But I agree. I think the collaboration, that we have is really like the key because the sex tech industry, the sexual wellness industry, is a multi-billion-dollar industry, and new products are coming out. And as a healthcare provider, I can't stay on top of it. But you can. That's where I'm going to rely on you and your company
Yes.
to, continue to be in that innovative space and to understand, hey, what are the good products out there these days and how do I get those in the hands of my patients?
Well, you and I are already collaborating, and I'm excited to tell everyone about that because we have an event in Miami on May 1st at your brand new practice, the Prime Institute, which, by the way, for our listeners, and I'll have you tell us more, but she shares that practice with your twin sister, right? And what
Absolutely. So
doctor is she?
So she's a gastroenterologist, and her practice focuses on medical weight management and sports nutrition. But just like with her practice, people want to understand how to eat to feel well. And with my practice, we have actually a lot of overlap because food and exercise are really the foundation for sexual health and also overall wellness. So even though they seem like two very separate practices, there's also like this great collaboration in the middle.
Absolutely. I see the connectivity very clearly because, at Stimulate, one of the things we always say is from head to toe, young to mature, purpose to pleasure. And that's what we represent when we define sexual wellness. So certainly wellness, head to toe, young to mature, purpose to pleasure does include, how you feel and if your weight and the health is going to influence that for sure. So on May 1st, we look forward to doing what we refer to as Stimulate Conversations, which is the name of this podcast, of course, but Stimulate Conversations Live. And it'll be at Prime Institute Miami. And we'll be welcoming various medical professionals, other urologists, OBGYNs, leaders within the space. And then we will soon be announcing the various people, but we will have a moderated panel discussion that, of course, Dr. Pearlman will be a part of and some others. So we're so excited for that. And I know we're going to have an amazing evening that night talking about, again, sexual wellness. So I'm very much looking forward to that. Is there anything else you can share with our listeners about this new, modern, I look at it as a very refreshed approach to your medical practice with how you are welcoming patients? This is new for you. It's truly within the last months. Is that right?
Yeah, and when we talk about sexual wellness, we have to use the language that our patients feel comfortable using. And so even asking them like, what terms would you like me to use to describe your body parts? Or what terms would you like me to use to describe these products? Sometimes it's going to be sex toys. Sometimes it's going to be sex tools. Sometimes people want us to medicalize it. Sometimes they don't want us to medicalize it. So at the end of the day, we can overcomplicate it or we can simplify it and just ask the person sitting in front of us, what type of terminology do you want to use during this conversation? But the way to destigmatize this topic is for me as a healthcare provider to get into the community outside of my office and start talking about it. And then for companies like yours to get into the healthcare setting and to start talking about it. We have to get out of our silos and really collaborate in the middle.
Yeah, I love that. And certainly what we're doing here at Stimulate. And I love that we have the support of medical professionals like yourself. So thank you for that. We do something here at Stimulate Conversations called rapid fire questions. So I want to go ahead and do that with you, Dr. Pearlman, as well. So you ready?
Ready.
I'll kick it off. All right. What does sexual wellness mean to you?
Feeling good in our bodies and having good sex, whether it's by ourselves or with a partner.
And how do you define customer service?
Instead of asking the question, what questions do you have? Instead of asking, do you have any questions? Asking, what questions do you have? Encouraging people to ask questions.
Love that. And what keeps you personally inspired?
I think sexual health for me personally is so important, and I want other people to experience really good sexual health.
And what keeps you professionally inspired?
Probably the same thing.
Yeah.
But also, I love talking. I love listening. I love destigmatizing conversations, normalizing conversations. And I feel like it's my job to do that when it comes to sexual health and men's health.
That as well. And what is the best advice you have for business leaders?
Show up and find the right room. And oftentimes showing up it's the most difficult thing, but also the easiest thing. And in order to find the right room, you have to show up to a lot of different rooms. I love being the dumbest person in the room. It means I'm in the right room.
Absolutely love that. Well, thank you so much, Dr. Pearlman. I am so excited for our May 1st event in Miami and to continue the conversation with you throughout the year. We love that you are a part of our Stimulate community. So thank you for joining us today. And thank you to those who tuned in as well.
Thank you so much for having me.
Stimulate Conversations offers year-round ways to stay in touch between our podcasts, including a private Facebook community for ongoing and more in-depth discussions, which you can find via Facebook at the group name Stimulate, Sexual Wellness Business Discussions. You can also stay connected via Instagram at the handle Stimulate the Show. And you're welcome to email us at stimulate@retailminded.com. I'm Nicole Leinbach, founder of Stimulate and your host. And together with the entire Stimulate team, we look forward to continued discussions that will, you guessed it, keep you stimulated on the business of sexual wellness. Till next time, stay stimulated.